Hi, how's everyone? Thank you so much for joining us here. We're having our fourth community health talk, and we're going to be speaking in regards to benign prostatic hypertrophy, or BPH. After or at the conclusion of this talk, we would love to have some questions if you should have any. And if you have any additional questions past that point, or if you would like to have a consultation, we'd be more than happy to set that up. We will have an email address or a phone number in which you can contact. I would love to see you in the office if you would like to discuss your urologic issues any further. In regards to BPH, now, BPH stands for benign prostatic hypertrophy. People otherwise call it an enlarged prostate. And what it is, it's a non-cancerous enlargement of the prostate gland. BPH is not an indication or a predictor of cancer. So therefore, what we will first do is we will discuss your prostate in regards to both symptoms as well as any increased risk or lack thereof of prostate cancer. Prostate cancer still needs to be ruled out first before we can start to talk about symptoms. Now, states continue to enlarge. Unfortunately, it says the prostate enlarges. As you can see with these cartoons down below, when the prostate is nice and small, the urethra, the tube that passes directly through the prostate, is nice and open, and it's easy for urine to pass through that prostate, and you're able to exit your urine from your bladder. But as your prostate enlarges, what happens is it closes down, or it kind of impinges upon the urethra. And when it impinges upon your urethra, what happens is that it makes it harder or more difficult for your bladder to pass urine through that obstructive prostate. Here are some more pictures that shows that as your prostate enlarges, and again, this is benign enlargement of the prostate, these types of cells are a conglomeration of BPH cells, which are called adenoma. What happens is that the adenoma will build and will tend to occlude or close off this tube of the urethra. As you can see in live uh, pictures, when your prostate is enlarged, it's very nice and open. It's easy to pass urine through that urethra. As it gets mildly enlarged, as it does in most men as they get older, you'll start to see that these two, what we call the lateral lobes of the prostate, they'll start to impinge ever so slightly against the urethra, starting to make it more difficult for your bladder to empty. And lastly, as the symptomatology or as this adenoma enlarges, there is greater impingement, and that greater impingement will make it even more difficult. It will restrict urine flow, thereby making the bladder work even harder to pass urine through and through that urethra. Now, what happens with this over time is that the bladder is a hollow muscular ball. And what happens is when it pushes or squeezes urine past or through a non-obstructive prostate, it works very, very well. It's able to store urine. It's not very overreactive. And that's when there's a lack of symptoms. But what happens, and why benign prostatic hypertrophy is so important, is not it's more because of over time, there are detrimental effects to the bladder. Now, what will happen is that that bladder, which is a hollow muscular ball, it will start to work harder. And like any muscle in your body, as it works harder, it tends to thicken. And as it thickens, this bladder wall or this vesicle, this bladder doesn't work as well. And the reason why it doesn't work as well is because a thickened bladder wall doesn't stretch as well. And if it doesn't stretch as well, it's not going to store as well. And if it doesn't store as well, then you're going to go to the bathroom more often, and you're going to wake up more at night. Now, what also happens is that this thickened bladder wall is like any other muscle if you overwork it. And what happens when you overwork it is it becomes much more spastic, much more twitchy. It's no different than going to the gym and working a certain muscle group. And as you're walking out, you can feel the muscles tighten up a little bit. You can feel the muscles that are spasming ever so slightly. And that's exactly what happens in the bladder wall as well, such that when this bladder fills with urine, a normal response is when it gets to its limit, it will talk to your brain. Your brain will say, okay, let's relax a little bit. It will create a little bit more space and it will allow urine to fill ever so slightly, so it'll make it a little bit easier for you to get to the bathroom. Well, a thickened bladder wall, one that is much more twitchy, one that is much more overactive, what happens is that when the bladder fills and it reaches that critical limit, whatever it may be, instead of relaxing, which it should do, it clamps down and gives you that, I got to get to the bathroom right away type of sensation. And that's what a lot of patients will see. They will see that they're going more often, they're having more urgency to go, they're waking up more at night. And what you can see in this picture is that this nice smooth architecture of the bladder is what it should be. But if you overwork it, what happens is it forms these fibrotic type of of cells that is essentially dead tissue. And what happens is that with this fibrotic tissue, that signifies dead bladder tissue. Dead bladder tissue does not work as well. And if you allow this type of process to take place over long periods of time, this fibrosis will continue to increase and your bladder will decrease in functionality. And if given a long enough period of time, your bladder actually will stop working. And at that point, there's not much that we can do. Now, at that point, not to really scare you, but the truth of the matter is that this takes a long time to take place. And that fibrosis does happen over long periods of time. But what we're trying to do at this point is we're trying to encourage our patients to understand what the symptoms are and to act upon the symptoms a little bit sooner. I will say it's something that we did very poorly as urologists in the past, is that I think we waited just a little bit too long for these symptoms to progress. And as they progress, that's when the damage takes place. So now we're trying very hard to be a little bit more proactive with our BPH symptoms so that we can avoid those detrimental effects from happening. Now, what are you going to see as you develop more symptoms of benign prostatic hypertrophy or BPH? You're going to go to the bathroom more often. You're going to have more urgency to go to the bathroom. It may be a little bit more difficult, meaning having to strain past that obstructive prostate, and sometimes that can be a little bit painful as well. It will translate to a weakened urine stream. It also gives you a sensation, even when you're done, that you're not completely empty yet. And you'll also have an intermittent flow, which is a stopping and starting of your urine stream. Now, where does this affect us? It tends to affect just our general lifestyle. Over time, what will happen is men will tend to work for the bathroom too often. They're going to be waking up too much at nighttime and not get appropriate sleep. They're not going to do their daily activities as they would normally plan because they're too consumed about going to the bathroom. And this happens very, very commonly. Now, how do we diagnose BPH? As we stated before, we first have to rule out signs and symptoms of prostate cancer. So we will have to perform a complete medical history and physical examination. We will need to do tests like a PSA, which is a blood test for prostate cancer screening. We'll have to do a digital rectal exam to make sure there's no lumps or bumps that are present on the prostate. And once we've identified that the PSA is not elevated and there is a normal digital rectal examination, we can start to talk about your symptoms, because that would put you at a low risk for underlying prostate cancer, and very likely we'll be able to talk about your BPH symptoms at that point. Other things that we'll do to assess your BPH symptoms is we'll do something called a bladder scan, which is a simple ultrasound of the bladder to assure ourselves that you are emptying out your bladder as completely as possible. Next, we'll do a symptom score, and this symptom score is called an IPSS, International Prostate Symptom Score. It is an international test in which we give to all men that are having worsening of their urinary symptoms. And what this will do is it's a good assessment of how one is urinating. It's a good assessment of whether your symptoms are worsening. And it also will tell us how bothered you are by these symptoms. The thing about urination is that it's very difficult to assess over long periods of time. And the reason is because these symptoms change very, very slightly over very long periods of time. So you lose reference of how you are urinating over those periods of time. And something as simple as this IPSS is something that can be helpful to determine whether you are having worsening of symptoms. Other types of diagnostic types of tests we can do is one's called a uroflow, which looks at how rapidly you urinate. Another one are pressure flow studies, which could be either something called urodynamics or a urocuff device that looks at how well you are urinating in addition to how much pressure your bladder is exerting to see whether there are obstructive flow patterns. We may ask or may perform what's called a transrectal ultrasound that gives us an idea of how large the prostate is. And lastly, there's something called a cystoscopy, which is a look on the inside. This is very important in diagnosis of enlarged prostates because everybody's prostate's a little bit different on the inside as far as how the prostate is obstructing the urethra. We'll also be able to assess the inner lining of the bladder, look for that trabeculation or that fibrosis that we talked about in the past to get a much better idea of what's going on the inside. With these symptom scores that we referenced before, there is kind of a grading system to give us idea of how poorly you are urinating or not. And this is, again, something that we will reference that we can, over time, determine whether your symptoms are worsening or staying stable. There are a multitude of treatment options that are available for BPH. The very simplest one is watchful waiting, and watchful waiting is for patients that have very minimal symptoms. It doesn't require any sort of intervention, but again, allows us to monitor your symptoms over time. Technically, or typically, if it's not affecting your overall quality of life, rarely are we going to intervene. Next are medicines and herbal remedies. Now, the advantage of these medicines or herbal remedies is that there's no surgery involved and it may provide enough symptom relief to improve upon your quality of life. The problems are is that it is a medicine. And one thing that I think that we're trying to move away from a little bit is that the majority of the time that a man has worsening of their urination symptoms, it's caused by the prostate. And it's caused by simple plumbing that is obstructing that pathway and making your bladder work too hard. And I think just from a really simplistic thought process is, why would you like to use a medicine that can affect the entirety of your body if we know where the source is and we are able to intervene upon that source in order to make your symptoms better? There are side effects that take place with both medicines as well as herbal remedies. And those potential side effects are a lowered sex drive, erectile dysfunction, ejaculatory dysfunction, dizziness, lack of energy. These medicines can be expensive over time. And I think another potential damaging problem with medicines is that if the medicines aren't fixing the underlying obstruction, I feel that there can be a possibility of potential worsening of your bladder function over that period of time. Some people refer to it as just a band-aid to make things better, and that's true. I think there tends to be more disadvantages with medicines than there are with other types of intervention. Next is something called the urolift or the prostatic urethral lift, and we'll talk a little bit more about this in the not so distant future. Next are what are called thermotherapies. Thermotherapies are heat inducing procedures that will either for lack of a better term, sear the prostate, heat it up very, very high to very high temperatures that will kill the cells of the prostate, which will later cause the tissues to regress to make your symptoms a little bit better. A lot of these procedures, or most of these procedures, are performed in the office. Some are done under some local anesthetic, Most are requiring a little bit more, may it be nitrous oxide or a sedation in order to make you comfortable. Some issues with the thermal therapies is because we're utilizing heat, heat causes inflammation. Heat causes more inflammation. And the more inflammation that is present, the more symptoms that patients have. So, although some of these procedures are effective, because of the heat, it will take longer periods of time in order for the patient to get better. They will have more symptoms in regards to urgency, frequency, nighttime urination, burning while urinating, higher rates of urinary retention or inability to urinate. Again, they can be very effective. However, these are potential side effects that can happen over long periods of time. Potential side effects that can happen immediately after the procedure. And I just feel that there are some therapies that are slightly better in those regards. Next are more major surgeries. These are things that are typically done in the hospital. Things like green light, laser vaporization, or just a green light TURP, transurethral resection of prostate. This has been performed for many, many years. It is still considered the gold standard. It's very, very effective, but it does use heat. And as we have already described, heat does induce more changes of the surrounding tissues, which will influence the inflammatory response that takes place afterwards, which will result in more symptoms postoperatively. Typically, these are performed in the hospital setting, which a lot of patients do not want to do, and they will have a higher side effect profile. For instance, they do have effects on erectile dysfunction. There are significant effects on ejaculatory dysfunction. Urinary incontinence is a possibility, but the risk is very, very low. And these are things that your urologist can be very cognizant of to minimize that risk. There is also a risk of stricture disease, and what that is scar tissue formation that happens within the urethra that will make it difficult for you to urinate. And these are things that are much less often happening with those lesser invasive in-office procedures. But sometimes when it comes down to it, if your prostate is too large, these would be necessary. Now, what we'd like to do is take a little time and speak of the UroLift system. Now, what is the UroLift system? It's a procedure that we do in the office. I personally do it under a little bit of sedation, so something very similar to, not similar, but the same thing that you would get with a colonoscopy. And so you are breathing on your own, but you are asleep and not feeling any form of discomfort. Now, what takes place with this procedure after you're put to sleep? A camera is placed through your penis into your prostate. As you can see here, what happens is that this device will deploy a hollow bore needle that will go through and through the lateral lobes of the prostate, and it will deploy what is called a capsular tab. This capsular tab has a nice little hockey stick appearance to it, which enables it to kind of lock on to the outer capsule, which is very, very fibrous in nature. Once it locks onto that outer capsule, the urologist will then compress the tissue. And what we found is that BPH is very compressible, it's very spongy. So we will compress it to the desired amount. And then another clip, what is called the urethral end piece, will come across and hold that tissue in place. And what it does is it creates a nice wide open pathway in order for your bladder to exit urine out through your prostatic urethra. Now, this is what is called a urethral or a UroLift implant, and it is very simply, it's two little tabs with a string in between. This is made out of a material called nitinol, which is a very flexible metal. This is made out of stainless steel, and this suture right here is just made out of polyester. All three of these elements are things that we use very, very commonly in the operating room. When you get surgery, these are entities that we've been using from a surgical standpoint for many, many years. So therefore, we know that our bodies react to these in a very, very safe fashion. Now here's a nice little cartoon depiction of what takes place. So what will happen is that a needle will deploy through the device, latch on to the outer capsule. We will compress that tissue, and we will then throw this urethral end piece to hold it in place. We will typically utilize anywhere between 4 and 6 implants, sometimes as much as 7, depending upon the size of the prostate, in order to keep that urethra nice and open. And what you can see here is that you'll be able to open up that prostatic urethra in a very wide fashion in order to make it easier for your bladder to empty. This is a real life picture of an obstructive prostate. If you can imagine, the bladder is behind the picture, and this tissue right here is causing an obstruction, impinging upon the urethra to make it more difficult for the bladder to empty. And again, if it's more difficult, the bladder works harder. If the bladder works harder, then it becomes thickened. And that thickened bladder wall is something that over time will cause unfortunate damage. Now, what will happen is with just in a prostate like this, 4 implants, we would be able to open up that prostate very nicely. This procedure takes 5 to 10 minutes at the very, very most, and you're able to have a fantastic result, as you can see in this picture. Now, what to expect post-operatively? Now, when we talked about those symptoms that the thermotherapies have, as well as the other procedures that were performed in the hospital, what we see is that with the UroLift, we have the same exact symptoms. There is urgency, there is frequency, there's nighttime urination, there's a little bit of burning when urinating, there is blood that you will see in the urine, and that's normal. But the big difference is that these types of symptoms will last for about 1 to 2 weeks, whereas the other ones will last for months, 1 to 2 to upwards of 6 months. Sometimes you can have those irritative voiding symptoms with the other types of therapies that we utilize. That's where the UroLift really goes above and beyond. Not that the symptoms don't stink, because they are. You know, I typically do them on a Thursday, and most people will complain, you know, over the weekend. They're definitely near the bathroom. You can still do all normal activities. I do encourage no strenuous exercise or heavy lifting, typically for over that weekend. You can resume all activities on Monday. However, you're definitely near the bathroom, no doubt about it. So I don't want to demean the symptoms, but the type of relief that you will get after a couple of days, upwards of 1 to 2 weeks, is well worth it. And they have been able to prove that there is durability of this device of 5 years for approximately 85% of the patients that were in the initial study of the UroLift device. Now, the insurance coverage is very good at the present time. All commercial as well as government insurances are covering the UroLift device. There are some limitations that we could very much discuss in the office if need be, but the coverage at this point in time is very, very good. Now, things, you know, we're nearing the end of this talk, and thank you so much for joining me today. And what we want to talk about is bladder health. Now, admittedly, bladder health is something that we don't have a lot of fact behind. But as a urologist and speaking to many urologists across the country, many of us will agree from a realistic standpoint that, you know, if you overwork the bladder, eventually it's going to give up. It's quite resilient. So these types of things that we talk about do not happen overnight, and they honestly take years to decades in order for there to be worsening of symptoms. But as we also discussed, is patients tend to lose insight on how they're actually urinating. So sometimes it's good to come see the urologist to make sure that you're urinating as good as you think. The bladder and its life is finite. It doesn't last forever. Once it's gone, unfortunately, you can't get it back, and a permanent catheter or an intermittent catheterization is something that is necessary. So we're trying our best to try to act in a proactive fashion in order to avoid these types of events that take place over long periods of time. So if you want to talk about medicines versus procedures, I personally think that the UroLift device is something that's superior to medicines. Medicines don't fix the underlying problem, and if you don't fix the underlying problem, then there can be continued obstruction. If there's continued obstruction, then what takes place is the bladder continues to work equally as hard. So therefore, if it's working hard, the risk of the bladder function decreasing, the risk of the bladder not working as well over long periods of time will continue throughout the use of medical therapy. So therefore, procedures will provide a much greater or wider channel throughout the prostate. Therefore, the bladder doesn't have to work as hard. And if it doesn't have to work as hard, then it will be able to stretch more. And if it's able to stretch more, you'll store more. And if you store more, you're going to go less often, wake up less at night. In addition, why take a pill that can interact with the entirety of your body, whereas you have a 5-minute procedure that can be done in the office in a very, very safe setting to fix the underlying source. Overall, UroLift has fewer side effects than medicines do over time. And the UroLift in my hands will improve lower urinary tract symptoms 2 to 3 times better than any medicine would be able to. Now, I want to take just a moment and say, during these very difficult times of COVID-19, New Jersey Urology has taken dramatic steps to try to make, the environment of the office as well as our procedure rooms as safe as possible. I truly feel that at this present time that we are able to intervene, whether it be via a consultation or a procedure in the office, in a very safe setting and protecting you as best as we can against COVID-19. So please don't be hesitant to seek a consultation so that we can discuss this a little bit further. We also offer other other venues in which we can discuss things via telehealth if you so choose. So we're going to take a moment and just answer some questions that people may have that we've developed over time or over the course of this talk. One is, if I'm currently taking medicine, do I need to stop taking it before the UroLift procedure? The answer is no. Typically speaking, if the medicines are helping you, I would continue with them until the procedure is performed, and then typically 2 to 4 weeks afterwards, depending upon what your response to the procedure is. Sometimes I feel that medicines like the alpha blockers can sometimes help transition through the inflammatory phase and make your symptoms a little bit better. After we've assessed your symptoms and feel that you're over the hump, I will have you then stop taking the medicines at that point in time. Next, what happens at 5 years following the UroLift procedure? Do I have to have it again? At this present time, I've been utilizing the UroLift procedure just over 5 years, and I'm starting to see those patients back again. And although my retreatment rates are quite low, they are happening. And what I say to everybody is that at the present time, it's lasting 5 years, and my data has supported that. When your symptoms return, we will reassess your symptoms and see what you need to have done. Can you have another UroLift? Absolutely. The truth of the matter is that your prostate, as already stated before, is an organ that will continue to grow until the day that you die. So having to do other forms or other interventions of your prostate is an unfortunate fact of life. But if you had a good result with the UroLift, I don't think that you're going to have any problems having the UroLift performed again to continue with your improvement of your urinary symptoms. Next, Is there ever a time the UroLift procedure cannot be used? Actually, yes, the UroLift procedure at the present time is indicated for prostates from size 0 up to 100. Used to be up to 80, but there is now an indication of being used up to 100 as approved by the FDA. For prostates that are greater than 100, officially speaking, we do not recommend the UroLift procedure. And it'll be at that time that we have to talk about other interventions. May it be a TURP, transurethral resection of prostate, or even larger procedures, something like a simple prostatectomy or robotic simple prostatectomy, in order to remove that large prostate gland. And then lastly, is a follow-up appointment required after the UroLift procedure? Anytime that I perform a procedure on my patients, I want to see you back. It's very important for after the procedure that you are emptying out your bladder completely. Although the risk of urinary tract infection is less than 5%, it is a possibility, and that is something I want to check to make sure that there aren't any infections. And I just want to be able to answer any questions that could be taking place immediately after the procedure. If those things are well, then what we can do is set up telehealth visits to have further follow-up periods, or excuse me, follow-up discussions to make sure that you continue to have improvement in your symptoms. So, thank you so much for joining me tonight. I thank you so much for taking out a little bit of time in your evenings in order to learn a little bit more about BPH. So thank you once again. If you would like to seek out additional consultations, please notify me at the address, at the web address that is present. We'll also be reaching out to you via email, so that we can stay in contact and schedule any additional appointments if you so desire. Thank you so much for your time and have a great evening. Bye-bye.